Hey, I heard about the lice problem. Don't feel bad, we've all had lice. It's normal. I'm gonna get some information from you, okay? And then we'll check for the lice and then we'll just get it out of your hair and you'll be good to go, okay? So can you just give me your phone number first of all so that I can reach you just in case I need to, okay? And how do you spell your name? Is that your first name? Okay, and your last name? Perfect, and just your address. Perfect, okay, so sit still for me. Okay, and has your scalp been pretty itchy? Yeah, that's definitely a sign of lice, so I'm glad you're here because I'll be able to help you. What I'll do is I'll just look through your hair really quickly here. Okay, yeah, I definitely see the lice for sure. Spreading your hair apart up here. Okay, for sure. So I've got my serum here and I'm just gonna put a little bit in my hand and then I'll put it in your hair, all over your hair. This will get rid of all the lice and it'll just be easier to take them out with this. Okay, we're just gonna drop this all over your head. Just a little bit more right here. Okay. And I'm going to be using this right here to just scratch them off of your scalp and get them loose. Okay. Sometimes they're a little bit hard to get off of the scalp because they're so used to being there. But as soon as we loosen everything up, they'll be easier to take out with a comb. Are you feeling okay? This doesn't hurt or anything, does it? Okay. Perfect. Awesome, almost done. All right, I'm gonna get my comb and we'll comb them out, okay? So just hold on one second, I forgot my comb. I'll be right back. Okay, I got my comb here, so. Oh, there we go, we got quite a few here. We'll just put them in there in that little trash bin there. Okay. Oh, a lot more, okay. All right, it looks like we got them all. Yep. Let me use my light to just double check and make sure that they're all gone. Okay. Okay, they're all gone. You're good to go. And I'll check you out. And yeah, if you have any other issues or anything else, just let me know, okay? All right, and I've checked you out. Hey, come in, take a seat, take a seat. You're here for your eye exam? Okay, just need some information from you. Your first name, last name, and your address. Okay, and do you wear contacts right now? No? Okay. And do you have glasses at home that you sometimes wear for reading? No, so no glasses, no contacts. And you're not worried at all, you're just coming in for a checkup. Perfect. Well, let me do some examinations on you and then you'll be good to go, okay? So can you just look at this light for me? Okay, and follow it. Perfect. That was good. And now can you look at my nose, please? All right. And just keep looking at my nose, checking your dilation on your eyes, okay? Good. And this side. Good. All right, so I've got this chart here, and I would like for you to read some of the letters if you can. So let me know if you can't, but if you can, just read the letters I'm pointing to. So we'll start off here. Okay. Okay. P, yep. Okay, so you read that fine. That's great. Now I'm going to put a lens over your eyes, and I want you to let me know how many fingers I'm holding up, okay? So we're just going to be doing that right now. All right. And how many fingers? And now. And now. And now. And tell me when my fingers are moving. Perfect. And let me know when you can't see them anymore. Perfect. We'll take the lens off. All right, you're doing great. Last but not least, we'll be doing a color test. Okay, so can you just look at this little chart for me here? And can you give me this color? What is this color? Okay, and this color, and this color, and that color. Okay, and what's this shape? Okay, and this shape? Exactly. We're going to be doing 2 more color tests. One is this color. What is that? Okay, now look at the dot. Okay, keep looking at the dot, keep looking at the dot. Perfect. And what is this color? Exactly. Well, you're looking good. You don't need glasses. I'll write that down. Type that up. Does not appear to need glasses. Eyesight appears to be 20/20. All right, perfect. Well, we will see you again next year, so have a great rest of your day. Hey, welcome to your ear exam. How are you today? All right, can I get some information from you? Okay. Have you had any recent pain in your ears? On the left ear here, right over here. Let me feel it. Okay, how about here, right here? Is that where it is? Pain over there? Okay. Let me write that down and we'll focus on that area. Okay. And have you had your ears cleaned before? No. Okay. All right. So what we'll do is we'll go into the right ear first and then the left. So I'll just walk you through what I'm doing, but I'm going to actually be pulling your ear so that I can look inside. So I'll be using my handy dandy flashlight. Okay, so I'll be pulling your ear, and I'm just pulling right now. Just looking in here for excessive earwax. Not too bad on this side. Okay, and I'll be pulling on this ear and pulling right now. Yeah, there's quite a bit of earwax in this one. I think that's maybe why you're having a little bit of pain in this one. There's a lot of earwax in there. So what we'll do is we'll clean that out for sure. So I've got my saline solution right here. And just gonna put some of this in your ear, okay? So open this up. I'm gonna squirt some into your ear. Okay, can you feel that? All right, we'll do this side. Is it uncomfortable at all? Okay. All right, perfect. And then we will get all of the earwax with this little device here. Okay, so I'm just going in and scraping at your ear. Ooh, wow, that's a lot. looks like we got almost all of it out. Let's do this side here. Okay, we got a lot out. All right, and I'm just going to be using a Q-tip really quickly here and getting the rest of it out. Okay, and this side. Perfect. Let me take one last look. Looks good. Awesome. Your ears look great. Do they feel better? Does this ear feel better? Yeah? Okay. I think there was just too much buildup of earwax. Okay, so just let me type the information into my computer. Okay, so I guess we'll see you next year for your yearly ear exam, okay? All right, well, you have a great day. Hey, you're here for your dental checkup? Okay. Can I get some information from you really quick? What's your first name? And your last name? And your phone number? Perfect. Can you just take a seat right there? Okay, so I'll just be putting my gloves on really quickly here. How's your day going so far? Pretty good? Yes, mine is going good as well. Okay, just going to be putting my mask on. Okay. All right, so I'm going to lean the chair back, okay, so that I can look into your mouth. So just lean back, right there. Okay, perfect. So, open your mouth and say, ah. Have you been brushing regularly? About once a day? I do see the plaque on there, so I don't really believe you, but that's okay. I understand life is busy. Completely fine. That's why you're here. So I can give you a cleaning, right? Okay. So we'll start off with just going on the inside and checking for any cavities. So just open your mouth and say, ah. Okay. Do you feel that? Is that tender? Okay, did you feel that? Let me take a closer look. Okay, so that one right there, definitely. Let me just type that up. We'll definitely be looking at C4. Okay. How about here? Top. Do you feel it there at all? Okay. And over here on this side. Okay. So other than that, I think we've only got the one that needs to be looked at for sure. Definitely do see a cavity forming. For sure. Okay. Do you floss regularly though? Okay. I'm just gonna scrape your gums a little bit. I want you to tell me if your gums are sensitive to this. Was that pretty sensitive? Okay, so you definitely need to floss more, okay? Because that'll strengthen your gums. All right, so that's done. Now, we're gonna brush your teeth really quick, okay? Because they really need to be brushed. kind of toothbrush do you use? Do you use an electric one or just something more like this? Okay. What kind of toothpaste do you use? Okay, well, we'll give you a sample of a toothpaste and a toothbrush that we recommend. And you can try that. Let me know what you think of that when I see you next, okay? One last thing, can you open your mouth? Can you stick out your tongue? I'm going to be cleaning your tongue. All right, we are all done here. You can sit back up. Perfect. All right, so you know you can do better with your teeth, right? I know it sucks hearing that, and I know that you've probably heard that before, but you want to prevent cavities as much as you possibly can. So try to at least brush your teeth twice a day and floss at least once a day, okay? So write that down. I'll tape that up. So that one cavity that you have right there, the one that I was looking at, I'm gonna book you in for an appointment, okay? How does Thursday next week work? Okay? Perfect. Well, we'll see you next week, Thursday at 9 a.m. 9 a.m. Thursday. All right. Well, thank you for coming in. You know, it's definitely tough to go to the dentist, I understand. But it's nice to know that you're taking care of your teeth, right? All right. Well, we'll see you next week, okay? Have a great rest of your day.